key thing here is that there are no absolute rights and wrongs. There's no divine wisdom here. It's decisions need to be individualized and tailored to individual circumstances, and they should take into account competing risks and priorities. So the sort of issues to think about are, first of all, what's the risk of acquiring the virus? And that, I guess, depends on how much of it is around. So, if we cast our minds back to last summer, everybody, relaxed because there wasn't much of it around, and the chances of picking it up were correspondingly low. There are issues. Another issue is how close are you going to be in contact with other people, through work and so on. And what precautions can be taken, so is there scope for flexible working, slight changes in roles that put a little bit of distance between you and the general public and so on. So there's the risk of sort of exposure to the virus. And the other issue is what would happen if you actually caught the virus, if you were exposed to it. And there the issues are how healthy is your immune system. There's a big difference between, having had, blood cancer treatment 20 years ago and being perfectly fit and well versus just having had a bone marrow transplant, for example. And then there's the issue of, I suppose coupled to that, how likely are you to be immune to the virus? Have you already had it? Have you had the vaccine? What are the chances of you responding to the vaccine? And then let's not forget other risk factors as well. So it's not, blood cancer isn't the only risk factor for having a worse outcome with COVID. Age is still important. Other medical conditions are still important. Obesity, diabetes, heart, lung, kidney problems, etc. So it's part of a sort of bigger jigsaw. So these decisions are never easy, but they need to take into account all of these factors. And the pros and cons of doing one thing versus another just need to be weighed up, and the decision needs to be individualized. And this requires internal consideration, but also benefits from discussion with family and also the specialist teams that are looking after people. So there's no right or wrong here. It's a very individualized thing.